Okay, so let's look at, every time we're doing massage, it would be nice to do some anatomy revision, yeah? So let's start with the upper limb, sorry, the lower limb. In a way, for me, the lower limb does not start with the femur. It starts really with kind of the lower back even, and then what's the name of this bone? Iliac crest, good. So this is the hip bone, iliac crest, and then this is, you can kind of feel it. Then this bone here, sit bone, or ischial tuberosity, yeah, good. And then this is the sacrum, good, and the coccyx, right? And then this bone is the femur, right? Now, in the femur, what can we feel? Can we feel that area? No. It's kind of covered with muscle back and forward. So what we can feel is this bit. Can you try to touch it and feel it? Yeah, it's a little bit lower than you think. Yeah, so it's not here, but lower. Do you feel it? Yeah. Yeah. Do you know how is it called? Greater trochanter. So it's a great, it's a big one, trochanter. And this is the shaft. And then what you can feel here is the patella. And then you can feel here the tibia, shin bone, and fibula. Yeah? Good. Now, let's have a look and see in terms of muscles. Which muscles are around in here? Yeah? Anyone remember which muscle?
Well, you have
starting in the
quads. You'll have the
quads in here.
You'll have the TFL.
You have the you have, let's leave it because it's a small one.
The cafe latte.
Cafe latte muscle, yes.
Yeah.
Yes, so tensor fascia latte, yeah, it's a small one here, okay.
And you've got the glutes around here.
Gluteus on the back of the hip.
The hamstring.
Hamstring on the back.
Yeah.
Sartorius, from here to here.
Gastrocnemius.
Gastro. And another one,
Soleus.
soleus. Good. And in front of the tibia,
The
tibialis anterior. Tibialis anterior, good. What about the middle adductor muscles of the thigh? And the iliotibial band on the outside? I think we're kind of there. Yeah, so it looks a lot, but actually if you're breaking it into areas, it's manageable. Okay? Good. Now, when we start doing massage now, I want you to start feel the muscles. So when we started the course, it was all right to say, oh, I feel the muscles, but now I want more names. I want more, that's what I do on that muscle. I want you to start feeling distinguished muscles and also get your palpation. What do you feel? Is it a knot? Maybe not. Maybe yes. Is it feel tighter than others? Okay. And bones. Which bone you touch now? Okay. So you're starting a new area, like imagine starting from the beginning of the massage, maybe you started facing up. So you did a bit of a neck, and then you finish the neck, you come and you can do a nice hold here. Even if you haven't started on the leg, it's nice to do a light hold to kind of welcome you into that new area. Good. Now, let's look at the draping. You're taking this towel a little bit upward, and you're moving the leg slightly to the side, and then the lower part of the towel go further, yeah, to here, and then you tuck this under. That's it. Okay, so try to do it in a swift movement. And instead, don't start to fidget with the towel too many times to try to fix it. So it needs a practice, yeah? You take the leg a little bit more to the side. You're having two hands. One goes further, but not uncovering the foot. Good. And tuck this under. Great. Starting with, which technique we're starting with? Good. Now, in the leg especially, effleurage can be quite long. So you might need to use all what you have with moving your body. If it's too much, then you can do just more step. Yeah? Or take one area and do it, and then do the other area. Okay? So you can do an effleurage, one hand after the other. Now in effleurage, it doesn't, sometimes I would say contradiction thing. Effleurage does not have to be light. Yeah? You can have an effleurage that the amount of kind of passionate giving you have is minimal. Kind of, yes, this is effleurage. It tickles. It's kind of, where is your passion? Where is your effectiveness? Yeah? Yeah, okay, I'm tickling alone. Okay, sorry. Or you can have a really, a nice effleurage that's really you're looking to drain that area, honestly. Yeah? Good. Good. Now you start using petrissage. So in this area, in the leg, petrissage, here I actually feel the chin bone. Yeah? So I can massage that, but I'm more interested either in the one underneath, which is the gastroc, or on this side, tibialis anterior.
That's the one I like.
So I can start using knuckles. Now, one thing about tibialis anterior is it's usually tight, especially if you go on a holiday. Because if you're wearing flip-flops, you're holding the flip-flop hard and you're straining this muscle, especially if you're walking on sand. So, or you're starting new sport. So it can be kind of very painful. So you can use your knuckles here lightly to start with. Yeah? Or you can do it with a reinforced thumb. Thumb reinforced, and it all moves together. How is the pressure?
Yeah, it's good.
Can I go deeper or?
It's about right actually.
Yep, okay. So even if I use petrissage now, I use my body. I don't just let it go with the hand. Yeah? Light movement, but still important. Okay, good. Now I can do also petrissage with, which muscle I'm using here on the fingers? Gastrocnemius. Which technique is that one? Ringing. Good. Good. Figure of 8 a little bit. Good. Oh, I find some tension. Stopping there. Reinforced thumb. No pressure from the thumbs, but I'm using more the other hand. Can I go deeper?
A little bit.
Is it okay?
Yeah, that's great.
And easing off. And then again.
It feels nice actually.
Good. And then. So you do it for a few times. It's kind of slow. You don't have to rush.
Is it compression?
Yes, compression. Good. Now say I want to do more of vibration. Even vibration a little bit with friction. Yeah, and now it's vibration. Okay? You vibrate it. You can do a whole more like shaking. And then you can do more like walking after. Kind of very light. I just hold the leg very light and just push it up, up and down, up. It's quite relaxing and it's minimal in the effort you do.
So can you
Right.
do the shaking, vibration, and the rocking there?
Shaking, vibration is local.
Yeah.
Shaking is a bit more the whole limb. And then rocking is the whole body. Getting into the thigh. So here you have 3 areas you can work. The front, the inner, and the outer. The front, which muscle do we have there? Quads. And sartorius.
Yeah.
Okay.
It comes from
It comes from here.
outside and
Yeah.
going inside. Yeah.
And we're having the iliotibial band here and the adductors of the thigh. Okay, let's start with more of a holistic approach, maybe try to get the front. So, yeah. Alternating hands, figure of 8, ringing. It's kind of really nice. You can take even the hamstring from here. Yeah. Now, what I want to do, because I cannot go on the inner thigh higher, I have it like in a diagonal shape.
Are these muscles diagonal?
No, they're going that way. But I can't go more in upward, so I can go more outside. Okay. Then you can do more of a specific work. You can turn the leg a little bit more outside, but still kind of comfortable, and then start working more specific. So I'm putting a bit of pressure here, or I can use both hands. Yeah. Go especially around the knee. Feel around the bone, and it can be kind of tender there. Yeah. So here, slow down, and then here comes the compression.
And it feels like quite a release there, actually.
Yeah.
So you're working on the tendon there.
It's on a tendon, yeah. So then, how about working with your knuckles? Is it too much?
Yeah, it's a little bit
It's a bit too much.
Yeah,
Okay.
it's quite
So
nice.
lighten up. Lighten up. I'm not working deep, but it's just tender area to work with. And what else I can do besides lightening it up to help her? Ask. But in terms of the technique, how
Use a different stroke.
different is different stroke. But even if I want to work the same stroke,
Use a little more oil.
or slow down.
Oh, okay.
Yeah, slow down.
Yeah, it's different.
But you apply the same pressure as before.
About, yeah. Is it okay?
Yeah,
Okay.
it's definitely tender there, but it doesn't feel painful. It's just
So, which technique do you think I should look for after? Effleurage, and after that, if there is tension and
Compression.
you can do compression. Yes, you can do compression even with a bit of a wider area or a bit of the thumbs.
So whenever you find the tension, apply compression.
Not always, not always. It depends. You can do pretty good with petrissage also. Yeah. Now I need to work onto the side. So what I can do two things. First, I can come kind of very low, and then use my wrist that way. Also, it will be easier if I will turn the leg that way, because it brings it up, do you see? So I can use my hand here. One hand would stabilize that, and the other hand would work. Now, it might be very tender here.
it feels
How's
good
that?
actually.
Yeah, okay.
Yeah.
You can do a bit of like racking, yeah, that, you know, you're having separate fingers. The other way you can do it, come from the other side, yeah, and then your hands are there, and you can do a lot more in detail work, because that's a lot more organic for me, yeah. Again, don't lock your knees, but frontally more bendy, and then you're just bringing your body width in. Good. Even in this position, you can go a little bit. Now I feel the greater trochanter. Yeah. Now I'm on a gluteus a little bit. Yeah. You can do a bit more, maybe movement of the leg. Yeah. A bit of maybe shaking. Yeah. Or using my base of the wrist. Or differently, using backward tension. Yeah.
It
Good.
feels good because it feels like you're lifting the whole muscle. Like
Yeah.
that whole thing.
I'm really actually, yeah, exactly, separating the
You
muscle
can
from the
almost
bone.
feel it. Feel the muscle lifting.
Okay, but be careful from that. More, bring your body together. Yeah. Okay, good. This position again, you can drape again. You can do a bit more shaking. Yeah. Have we learned the Portman?
Yeah.
Yeah, to Portman I used to do more with a towel because it cushions this a little bit.
You're not slapping someone's bare skin.
Yeah. Yeah, and here it comes. You can do then a bit of the Portman, a bit of rocking. Yeah, but you're amazed how well the blood circulation help with. Yeah. Good. So, shall we do some? Yeah. I want you to actually do all the technique we've done: hold, effleurage, petrissage, compression, the Portman,
Just on the lower limbs.
just on the lower limb, the Portman and the vibration compression. Vibration shaking. Yeah.
And the raking.
And the raking. Yeah. It's really nice on the iliotibial band.
Is raking effleurage or is that petrissage?
It's more like petrissage. Yeah, because you're trying to move things.
Yeah.
Yeah.
Oh no, we're not supposed to use